Are you feeling overwhelmed trying to choose a Medicare plan? Comparing Medicare supplements, Advantage plans, dental, vision, and hearing plans, and sorting out all of the commercials on TV and the ads in your mailbox can feel impossible. How do you know what's actually the best Medicare coverage for you? The good news is you don't have to do it alone. That's exactly why working with a Medicare broker can make your life so much simpler. My name's Hannah Skinner. I'm a licensed insurance agent at the Senior Savings Network, and in this video, we're going to explain how to determine if a broker is doing what's best for you, why using a Medicare broker will save you a lot of time and money, the difference between a captive agent and an independent broker, why insurance agents have earned a negative stereotype, why a Medicare broker's services are free to you, and how Medicare brokers get paid. Let's jump right in. So what does a Medicare broker actually do? A Medicare broker helps you compare Medigap plans with multiple insurance companies and guides you through the enrollment process. Think of a broker as your personal Medicare advisor. Instead of calling company after company or trying to read all of the fine print on your own, a broker helps simplify everything and narrow down the best options for your specific needs. A good broker looks at things like your doctors and other healthcare providers, your prescriptions, your budget, your travel habits, your health history and chronic conditions, and your long-term goals. The truth is, no matter how much research you do, the best Medicare plan for you might be different than from someone else's. One of the most important things Medicare beneficiaries need to understand is that there are two main types of health insurance agents. There's a captive agent and an independent broker. A captive agent works for only one insurance company. That means they can only offer plans from one specific carrier. For example, if someone only works for company A, they can't show you plans from company B or C, even if company B has all of your doctors in the network and fits your needs better. So their options are limited, and in turn, so are yours. Also, captive agents are often encouraged by the insurance company they work for to sell you one particular plan or type of plan. It's probably not a surprise that an agent might try to sell you the Medicare plan that's most profitable for the insurance company that they work for because it gives them the most commission. That's one reason why captive agents who work exclusively for one insurance company give other insurance agents such a bad reputation. Here's an example. A captive agent might offer a 65-year-old an HMO Medicare Advantage plan with no out-of-network benefits because it pays the agent around $500 a year. The agent might refuse to help enroll the 65-year-old in a high-deductible Plan G that allows the person to see any doctor or hospital anywhere in the country without a referral or prior authorizations. This is because it might pay the agent less than $70 a year. Before you enroll with an agent, ask them if they can sell Medicare plans from different insurance companies, and ask them if they sell both Medicare Advantage and Medicare Supplement plans. Now let's talk about independent brokers. An independent Medicare broker is contracted with multiple insurance companies, which means they work for you instead of a specific insurance company. They can compare Medicare plans A, B, C, and D side by side and help you find the right fit for your needs, not the plan that their company wants them to sell. For example, at Senior Savings Network, we work with over 30 insurance carriers, and we specialize in both Medicare supplements and Medicare Advantage plans so that we're able to give you unbiased options. We give our clients more choices, more flexibility, and more opportunity to find the right coverage. Medicare is not one size fits all, and what works for someone else might not work for you. A lot of people ask, how much do you charge? The answer is nothing. Medicare brokers are paid by the insurance companies when they enroll someone in a plan, so there's no cost to you for using an agent. In fact, you usually get more help and more support for no additional cost. And at the Senior Savings Network, we believe in being transparent and honest with how this works. Our goal is not to pressure people into plans. Our goal is to help people be informed about the decisions they make and feel confident about it. Another important thing to note when choosing an agent is knowing how much agents get paid based on which type of plan that you enroll in. It probably comes at no surprise to most people that agents get paid more to enroll you in a Medicare Advantage plan than in a Medicare supplement plan. That is why so many agents will try to enroll you in an Advantage plan or push you into a plan, no matter how bad you hear they are online. Now, in some cases, Medicare Advantage could be a good option for your situation, but if an agent is trying to force Advantage onto you instead of going over all of your options, it's likely because they have a financial incentive to do so. There's also a financial incentive to recommend Plan G or Plan F over a Plan N or a high deductible G. For Medicare supplements, agents are usually paid a percentage of the premium. So the higher the premium, the more money they make. There are also agents who refuse to sell a high deductible G or a Plan N completely because they think it isn't worth their time, even if it helps you save money. That's why it's important to work with a broker that you trust and that will tell you the truth. So why not just call every company yourself? Well, technically you can call almost every insurance company directly, but honestly, most people would rather have a Medicare concierge help them find the best plan than shop themselves. Think about it. If you call yourself, multiple insurance companies now have your phone number. So you're put on their marketing list to receive calls about their newest plan. You've had to repeat your personal information over and over again to different employees at different companies. And then you're left to compare benefits, networks, and formularies by yourself. Plus, you're probably not an expert on things like Medicare election periods or underwriting rules. If you end up enrolling over the phone or online with the company directly, there's no one able to help you track your application, no one to escalate things if there's an issue, and no one to be in your corner. A broker can do all of the comparisons for you in one free consultation. And a good broker knows things about the insurance companies like their financial standings and customer service that you likely won't find on the internet. Instead of trying to become a Medicare expert overnight, you can work with someone who's already an expert in the industry and can help guide you through all of it. It saves time, it reduces stress, it avoids making costly mistakes, and the service is absolutely free. Working with a Medicare broker isn't just about enrolling in a plan. It's about having ongoing support. At the Senior Savings Network, our clients know that they can call us whenever they need help, whether that's reviewing their coverage annually, comparing plan changes, getting help with billing issues, finding providers, or just answering general Medicare questions. We're always here for them. We also have access to helpful client portals and tools that make managing coverage easier and more convenient. And because we offer products other than just Medicare coverage, like dental, vision, hospital indemnity, cancer plans, 401k rollover help, and long-term care, we can help clients build more complete protection based on their needs without having to call multiple companies. There are a lot of Medicare agencies out there, so why do people choose the Senior Savings Network to be their Medicare brokerage? Well, first, we believe in honesty and education above all else. We're not here to push people into plans that don't make sense for them. We genuinely just want what's best for our clients. Second, we believe people deserve to understand all of their options and not just what makes insurance companies the most money. A lot of agencies push Medicare Advantage plans because they can be a $0 monthly premium, which makes them easier to sell, and they have a bigger commission for the agent. We believe education matters, and we believe informed clients make better decisions. Third, we offer choice. With over 30 insurance carriers and a wide variety of ancillary products, we can customize recommendations based on the individual, not based on one company. And finally, and most importantly, we focus on relationships with amazing service throughout your lifetime. We want our clients to feel supported. We don't just offer a transactional, one-and-done enrollment. We're here for you year after year as your needs change. Our team at Senior Savings Network is here to answer questions, compare plans, and help you make a confident decision without bias. If you found this video helpful, make sure to like, subscribe, and leave your comments below. You can reach us at the phone number on the screen or by going to our website in the comments below. And remember, Medicare doesn't have to be confusing when you have the right team helping you. Thanks for watching, and we'll see you in the next video.